I'm very happy to be with you here this morning. I hope you feel the same. Before we begin our discussions, let me ask you this question. Do you consider yourself a happy person? Please raise your hand.
It's checked at the door.
Well, if I ask you to define happiness, I'm sure I'm going to get so many different answers. But our esteemed panel believe happiness can be measured, should be on the forefront of the government's agenda, and are showing us in this global happiness and well-being reports how governments and what governments are doing to make their citizens more happy. They have every right to give happiness their utmost attention because more than 300 million people are suffering from depression worldwide. So let me introduce our panel. I would start with the ladies on this panel. Sorry, gentlemen, it's a woman's world these days. Her Excellency Ahoud Al-Roumi, Minister of State for Happiness and Well-being in the UAE. Her Excellency Maria Marques, Minister of the Presidency and of Administrative Modernization in Portugal. Jeffrey Sachs, Professor at Columbia University in the United States. And John Hallowell, Professor at the University of British Columbia in Canada. Jeffrey, for the second year in a row, you are issuing this report, which is supposedly to be a policy handbook for happiness. What is different about the 2019 edition?
Well, this topic, fortunately, continues to gain recognition of how important the whole initiative, government leadership on happiness is. The fact of the matter is there are a lot of happy people in the world, including in this room, and a lot of people who aren't so happy. And by trying to understand more systematically why people are happy and why they're not happy, we might be able to do something more about it. The purpose of this report is to look systematically each year at what is known, at what is being done in different parts of the economy, different parts of society, in business, in the workplace, in education, in the health sector, at the personal level, in government, to understand what we can do better. And these case studies in this year's report are aimed to be a real how-to guide. So this year we took the emphasis for all governments to do this, what really should be done. And there's some wonderful cases in here where you can see where successful interventions were made. And what is fascinating about this report is that not only is the case made of what to do, but actually the steps that were taken in these particular circumstances in the health sector and education are described. What government went through in order to do this, what kind of measurements were used. And so in any part of the world, the idea is get started because this is important and it really can help.
We will go back and discuss these points, but I want to ask John here. John, this is supposedly a complementary report to the World Happiness Index issued by the United Nations. And this report ranks Scandinavian countries as the happiest nations in the world. However, Scandinavian countries at the same time, they suffered from high rate of suicide and high usage of antidepressants. So how can you explain that?
I've been working in this field now for 20 years. When I started, in almost every audience, that was the first question I got. So I took a year off and I became Durkheim. I'd been Aristotle's research assistant when I got into this field. I became Durkheim's research assistant for a year and went back to Oxford and acquired experts in all those fields to discover. We found that in the data we had, exactly the same factors influenced happiness and suicide. In particular, social trust and personal connections are very important, we still find in happiness, very important as buttresses against suicide. Some factors like marital connections were much more important, or divorce, for example, on the negative, was much more predictive of suicide than it was of family happiness. And things like income were more important for happiness than they were for protecting you from suicide. So the same factors came into play. The two were the most common in terms of their effects, and opposite were these social connections and a sense of trust, a feeling of belonging. And when you think about it, a feeling of belonging is in fact a primary source of hope. And suicide is often described as a disease characterized by hopelessness. And so those two branches, admittedly, we're studying the worst off. There was a long Finnish study 30 years ago that took 10,000 adults and measured their life satisfaction at the beginning and then followed their subsequent lives. Those who at the beginning had themselves ranked low on the life scale were, among men especially, 4 times as likely to have committed suicide over the subsequent 20 years. So it turns out after my year, Durkheim was right. And he also, Durkheim, I'm going to shut myself up. I'll tell you more about it.
But John, is it the case that the Scandinavian countries are off the charts in suicide rates?
No.
No, but that I think has to be said.
That's another part of it. The only one, I mean, they're basically average, but the point is...
But that's the most important misconception, that people think that, no, that there's a big paradox there. But it's actually a myth that the Scandinavian countries are way off the charts in suicide. It's just not true.
The only exception to that is Finland, which is top in happiness, is above the world average on suicide. So we still need to make that case. But Jeffrey's right. That's exactly the first point to make,
right.
Is they're not off the charts on suicide. They are off the charts on happiness.
Right.
I want your opinion here, Your Excellency, because I know Poland does not rank in the top, not even 20 or even 50 when it comes to happiness. Portugal, sorry. It ranks 77th place. Why is that? Aren't you a happy nation?
Yes, we are not a very wealthy nation, as you know, but we have been increasing all the years. So we are doing our job to improve our happiness situation and to be happier in the present and in the future. It's why we are so interested in integrating this coalition to learn with others' experience and also to share our experience concerning well-being. We have some factors that are very important related to conventional policies to improve happiness. We have a national health service available to everybody for free. We have public education and quality public education. And also we are one of the more secure countries all over the world in the rankings, other rankings you refer. But we need to do more. We need to be more innovative. We need to be experimental. So we put forward December with Prime Minister in the room, so a very engaged program for the government, a work-life balance program, a transversal program, a collaborative program involving private sector in order to experiment new initiatives to improve work-life balance, our professional, personal and familiar life. They are unbalanced nowadays in different organizations, not only public but also private.
I would ask you later for more examples on these topics, but I want to move now to Your Excellency, Ahoud. I know that happiness is a serious business when it comes to the UAE. You are the only happiness minister in the world. The UAE launched a happiness council and also a coalition which UAE and Portugal is part of. So are you on a mission to make the nation, not only UAE, the world, a happier place? And how did you do so far?
Thank you, Laura. Let me tell you first about the UAE case. So Since he took over as the Prime Minister, Sheikh Mohammed bin Rashid was clear on the direction. We want GDP to grow, but we want to measure our success based on well-being. And let me quote him that the role of the government is to create an environment in which people can thrive, in which people can create and enjoy their happiness. And for us in the UAE, this is not just add on to government, it's a paradigm shift for how government can think their policies and programs and systems. I was appointed Minister of Happiness, and then well-being was added to put the well-being and happiness at the forefront of the policy agenda here in the UAE. And when I started my job, I had so many questions. How can we do that? What does that mean for government? And I had to travel the world looking for answers and examples and ideas and thoughts. And I discovered that we are not alone in this journey, that many governments around the world are thinking about it, are considering well-being and would like to implement it. And there are pockets of well-being examples around the world, whether at nascent stage or more developed stage. So to help us better understand and manage this and to help the world also, we started working with a large pool of stakeholders and global partners. And we took the initiative to form the Global Council for Happiness and Wellbeing, headed by Professor Jeffrey Sachs, with the esteemed guests of the council. And the purpose of this council is to help us as a nation and help also other interested countries understand this and give us practical tools, hence the report. I mean, the report is a very practical tool for us as government because we are interested on the how. And instead of going all around the world, the council put many examples and many ideas in 6 sectors for us as a government to inspire us and help us understand this well-being and happiness business and how can we implement it in our countries.
So this is what we're hoping here. We're hoping the audience will get a better picture on what governments should do in different sectors to enhance happiness. And let's start where the report started in the healthcare sector, Jeff. Can you give us examples? Where are the best practices to see healthcare in the positive lens?
Let me start with a general proposition about this subject and what all of the different topics really find. Happiness, first of all, can be measured. That's a basic theme. You can ask people about their well-being in different dimensions. You can measure different aspects of their well-being. What determines what you find? There, I think the evidence is very, very strong that there are individual determinants. We have an expert here on even the genetic bases of differences, but there are also differences of individual circumstances. Also, individual capacities to be happy, and we'll come back to that because there are things that people can do, obviously, to raise their own well-being through better lifestyle or mindfulness or other kinds of actions. Then there are the social determinants, how we relate to each other, and does society create and support social bonds, social support, social networks, or are we pulled apart? My profession, by the way, economics, is a kind of crazy profession. It has a term called perfect competition. Already, this is a terrible idea, that the best you can have in society is everything's perfectly competitive. Why don't we have a field called perfect cooperation? Where we're actually supporting each other. That's not what we learn. We learn and we're trained for perfect competition. So the quality of social support is really important. And the quality of politics is really important as well in several dimensions. People do not like to live in countries with corrupt governments. I know, I live in one. So
I know too, unfortunately.
Yeah, okay, this is a really important measure. We don't like to see, I won't get too political here. There are known figures in my country that are tax cheaters. in high positions, highest positions, but I won't get too political. We don't like that. It makes people unhappy. And so the politics is also an important part of this story. So this leads to a really holistic need to understand happiness and well-being in a holistic way, to be able to measure, and to be able to understand that the individualistic approach, if you go too far in that way, you're actually going to destroy the community approach, the social approach, the political approach. I live in the country that's the most committed to libertarianism. That's the ideology. Everybody's on their own. You just make it on your own. And if you go that far, you tip over the balance. You may be rich, but you don't reach the kind of happiness. So every sector we're talking about has those characteristics. And there's one more thing that I think is important for us to add to the discussion. There are a lot of forces working against happiness in society. We're talking about working towards happiness, but there's a lot of business that's actually trying to make us addicted, that's trying to make us do things which are not good for us, but they're good for business. Because if you want to run a successful business, sell something that's addictive. Your customers come, but you create lots of unhappy people as a result. And in many countries, people are addicted to all sorts of unhealthy lifestyles, to unhealthy diets, to unhealthy ways of living. And it's not purely by accident. It's by design, unfortunately. So we're working against powerful forces also. One city, for example, just as a weird case in the United States, this is how strange the country is right now. We have an obesity epidemic. About 40% of adults are obese. That's an addiction problem to an important extent because fast foods create addictions. And so one city tried to do something about it, San Francisco. It said to put a warning. And then that was thrown out because it violated the free speech of the companies. Only America could invent this, that you can't regulate against obesity and addiction because that violates the free speech of corporations. So we need to take a pretty holistic view of what we're really facing in this. And I think that every one of the different dimensions in health and workforce, in government, has that set of challenges.
John, if you want to go more into details into the healthcare sector, because healthcare consumes or constitutes a significant chunk of the government expenditures worldwide. It's on average 10% of GDP, what is spent on healthcare. From an economic point of view, how much do governments actually save when they invest in the happiness of the healthcare system?
The simple answer is we don't yet know. My guess is it would be monstrous in terms of extra health gained for resources mostly saved rather than added. And it has to do with changing the way that these expenditures, the results are evaluated, as well as delivering healthcare and designing it in very different ways. So the co-creation of health between the patients and the doctors and the providers, which is, think of what we've been talking about social cooperative connections and their power. Think what would happen if you get a co-design of the whole nexus between how individuals think about their own health and how they have team members who are actually professionally involved. You then have, as we already have developed, Ed Diener, one of our theme leaders, as a fully tested group of positive mental outcome questions. Every general practitioner should be using those along with the usual depression inventory. Once you start doing that, then you get into something that's called in the United Kingdom a social prescribing. The idea is that, in fact, you don't wait, although typically people in social prescribing do wait till someone has mental illness or some other difficulty, and then says, you know, there is a group at your community center that is likely to be fun and in fact to help deal with your problem. Once you get serious about this, you don't wait until someone has depression before you tell them and advise them and aid them to broaden and deepen their social connections. And once you get that, of course, the best recipe for good health is to have other people close to you who care about your health. Some of them will be professional providers and some of them won't, but they're all equally important. Well, that's so different. You see, we're used to thinking about healthcare and other things. Wait till a problem exists. We think of it as policing. We think of it in a lot of ways. Wait until a problem exists and then try and cure it. You wait for there's an illness and try and cure it. As one of my friends says, if you change I to we, you change illness to wellness.
That's an interesting point.
Very good point.
Very good. We all learned something just now. This is very good.
Your Excellency, Mrs. Ahoud, I know there's a mental strategy when it comes to the UAE. Can you tell us more about that?
So let me just continue the discussion on what Hallowell was saying. We are here at the World Government Summit. So the purpose of the summit is to shape the future of governments. And we truly believe that here in the UAE, that the future of government is pivoted on well-being. So well-being is not just add-on to education or health or infrastructure or workplace. It should be the core in each sector. And so therefore, in the UAE, we try not to make it just sector specific, but we try also to hardwire it in all our systems and policies, and also shift the mindset. As Hallowell said, how do we approach the problem? So in the UAE, for example, we have chief happiness and well-being officer in each entity, because we want each entity to put well-being at the forefront of its agenda. We established here in the UAE a tool or a filter via a tool of well-being benefit analysis. So anything submitted to our cabinet goes through a well-being list in addition to the cost benefit analysis, the traditional one. Also, we try to drive intergovernmental collaborative projects, because well-being is holistic. If you approach well-being or happiness, it's not just education, health, housing. You need to look at the blind spots and integrate all sectors so you have the mother of all outcomes, which is well-being. We have a comprehensive national strategy for well-being in the UAE. We have clear roles and responsibilities for each entity. And mental health is one of our priority and pillars in the strategy. And we work closely with the Ministry of Health to advance this based on the local context and the culture that we have in the UAE.
What can you tell us here, Maria, on this topic? I know that Portugal has enhanced tremendously on the Bloomberg Healthcare Index. The ranking is now 18, jumped from a ranking of 26. How can you tell us more? How did you achieve this kind of progress?
Yes, let me give you an example. But before, I would like to stress some words I heard from my colleagues of panel. Community, holistic view, holistic approach, competition, not only competition, but also cooperation, a mix, because we compete, of course, between countries, between companies, but we need to cooperate too. And co-creation, building together, designing together some initiatives. And let me give you an example from Portugal. We designed together among different public sectors, different levels of administration, central administration and municipalities, local governments, and companies, different kind of companies and with different dimensions, a program for work-life balance. It's a way to introduce happiness and well-being in our politics. Testing different initiatives, and I would like to give you two examples. First, a pact between 50 organizations from public and private sector, again, different levels of administration, to be certified by Portuguese standards on work-life balance. Introducing different initiatives, training staff, assessing satisfaction of those involved in areas such as work organization, professional development, and work-life balance services and benefits. They sign a pact and are going to work to be certified with these kind of standards, sharing experiences between private and public sector. And if we succeed, you can scale this standard and this pact to other organizations. And also in this program, it's called 3 in Line because it's professional, personal, and familiar life. We try to balance. We have some measures only for public sector because we think that the state gives the example. It's very good. One of them was inspired by Aruni in her visit to our country. We gave the mama and papa in the first day of his children's school time off up 3 hours without from the work to be with his children or children in the school. It's a small initiative, but it's an example in this kind of program, and after we can expand even to the private sector.
Jeffrey, since you're looking at the report, there's a big part also on education. Can you walk us through the steps on how to create a positive curriculum? Is it, for instance, by adding mindfulness classes like what we're seeing now in the United Kingdom?
We have some real experts in the room that have been doing this, so I speak with little trepidation. And Alejandro Adler is one of the authorities who's co-author of this chapter. The idea is that schools and school systems take seriously the well-being of the children, not only what test score comes out at the end of the year, but whether the children are learning social values, whether they're learning cooperation, whether they're learning behaviors that will help them in mindfulness and so on. And the beauty of this is that there are things that you can do in a curriculum that are really about training of attention, mindfulness, compassion, values. And when you add that to the school curriculum, it's been shown all over the world, Alejandro has been one of the lead researchers, that you not only help children to be better adjusted and to feel better about themselves, to be happier, but also school performance goes up academically. And so you get a 2-for-1 on this. It's not a trade-off that you're making a sacrifice. You're helping more rounded children in a better environment. But it's not simple to do. Teachers are not trained for this. The curriculum is not set for this. So you need a program. You need to really think through how to do this. And one of the big themes is you need to measure. What you do has to be locally specific, culturally relevant, and measurable, and tested. You do it in some schools and not in others. You see the difference of performance. You learn over time. So it is a kind of systematic application. But if you read this chapter with many, many specific examples and cases one can go to, it really is a message everywhere. Why aren't we doing this in our school system? Why aren't we doing this in our schools? Because this has been demonstrated in many different cultures to have a big effect on children's well-being and therefore their capacity to thrive in many different ways, including in academic performance.
I want your opinion here on what Jeffrey said. What are the challenges in embracing this positive curriculum? Is it training the staff? Is it acceptance from the staff? Or probably one should ask also, are teachers paid enough to be taught to teach children in a positive way?
throughout the chapters of this report, something that came to my eyes, and I think all of our eyes as we went through it, was the extent to which you really have to think seriously about getting the top to bottom buy-in in the first place, getting the breadth of agreement for what needs to be done, and then not only having the evaluation that Jeff talks about, but in fact keep maintaining that structure, and otherwise you won't get continuity. You want specific examples. Here is one, because I brought it into the synthesis chapter as an evidence of cross-silo cooperation, very difficult to get for lots of reasons. And this was an idea, and it's been done initially in Japan, but in a number of countries. Take an elementary class and actually have the class take place in an elder care facility. Okay. Well, this had been going on for several years in a school, and of great success. Parents were actually moving into that school district so their children could have this opportunity. You could imagine the richness of life you get from having these generations that traditionally ordinary families provided automatically, and increasingly is not the case, was creating synthetic families to a serious extent, not just a once-in-time visit to say, these are old people, these are young people, but they were making friends, finding teachers, learning about life and teaching life. So the elders were learning enthusiasm and relearning purpose, and the youngsters were getting a breadth of the depth that you might get in the curriculum, but just by simply changing the venue and the people with whom they were spending their time, you changed their whole outlook on life. So you asked for roadblocks. What happened in this very successful program? A new principal came into the school. The principal was convinced that the important aspect of education was to get test scores, and she wanted to put bums in seats and get them getting those test scores. The idea of this semi-managed class being out there in an elder care facility under the care of only a teacher was a very risky process. So the whole thing died. One person who didn't have a buy-in was able to stop it. And that's true of so many of these things. It takes many people to start them, but only one person to stop them. And so it's a real challenge to maintain the breadth and the cooperative spirit, and then to get it increasing from time to time, so that in fact anybody who comes into the school or the field or the hospital or the workplace thereafter says, that's the way they do things here, and by golly, it works.
I believe the UAE has a program to train public teachers into positive education. Can you tell us more about that?
Yes, so in the UAE we launched something called the Well Schools Network, and the purpose of this network is to take care of the well-being of the students, but also of the teachers, because the teachers are very important in the well-being process. So we developed like a playbook for each school to make sure that they focus on well-being as much as they focus on the core curriculum, like mental resilience, like emotional intelligence and life skills. And also we've been running a well-being census for our students and for our teachers. This is the second year for the census. We're taking the findings, consolidating it, and translating it into policies or actions on how can we enhance the well-being. Schools are very important for the well-being, not just for the mindset, but also for healthy lifestyle, for positive outlook for the future.
And this is only public schools? Would that
all
private
schools.
And
all schools, yes.
How about Portugal? I know that teachers are well paid in Portugal compared to other OECD countries. But I believe that the spending on education
Probably
is less.
teachers don't agree with you, but it's another problem.
So how much, what are
Okay.
you doing for
Yes.
teachers so that they can
Okay.
give a better curriculum?
Okay, thank you for your questions. We have a national strategy for citizenship education. We try testing in some schools, and now it's for all the schools, including value equality in interpersonal relationships, respect of human rights, and so on. And we have a platform with methodologies, contents, training sessions to help teachers to put forward programs of citizenship education, and this is for all the schools. It's a convention is now a public policy for all the system, and at the same time we are experimenting different methodologies. For instance, to give you two examples, we have developed cards to young children to play, and also an app gamification to children to play again with a game, and also including their families if they want in this kind of program. Now, with these two last initiative I refer, we are testing. The other is all over our schools. And let me come back to the standard. This is very important because in our diagnosis, we saw that there are some organizations with a very, very interesting good practice, and at some time or in the day after with very, very bad practices. So the standard is very important to make this policy continuous in an organization, in not the happy day and the bad day in the day after.
So we discussed education, we discussed healthcare, and of course we should discuss the well-being of the citizens in the workforce. And we all know lately that more and more companies are investing in the well-being of their employees because this is proving to be cost-effective to the company. When a company wants to do that, where does it start? Is it nutrition of the employees? Is it through paternity, maternity leaves? Where should we start?
I think there's an easy part and then there's a harder part when it comes to business. I think this year we talk only too much about the easy part, though there's a lot there that is useful. The easy part is that if your staff is happier, if they are well treated, if they are participating within the company in a fruitful way, they will be more productive. And the evidence is overwhelming for this. So businesses should know that smart business means employees, staff that are happy, and there are things that can be done in the workforce. The harder part that is not here enough is what is the company doing to society and what is it doing for customers? Because you could have happy employees producing a product which is wrecking the society. And I think that we need to make business aware and accountable in both directions, actually. That they will figure out to an extent, businesses, since so much of the focus is on the bottom line, if they read the report, they'll learn something good about their bottom line for sure.
Let's give an example, like phone addiction. The company won't take any measures, for instance, by itself. Should there be a policy from the government or laws governing, for example, or protecting our kids from
absolutely
addiction on social media?
This is where, if
addiction.
government is engaged as it is in this country, looking at well-being and measuring it and seeing, they would see right now there is an epidemic of adolescent depression in many countries that at least is associated, correlated with screen time right now. Social media are addictive. This is known. This is increasingly demonstrated. This is an addictive behavior. In fact, all over the world, there are treatment centers springing up for young children who are addicted to video gaming, addicted to online. We know how kids committing suicide because of self-image from social media and all of the behaviors. Come on, where's Facebook in this? Where are the other companies? What they are also good at psychology, but their psychology is to get more eyes on the screen, to get more time so that they can sell more advertising revenue. So they're not looking at the well-being of the users. They are looking at the bottom line. And the greed is unbelievable, actually. And so I want the companies not only to learn how to make more money, I want them to stop doing the terrible things. And I'm in a country that is filled with addictions right now, with the highest obesity rate in the world, with gambling addictions, with online addictions. We have a company that created an opioid addiction, and it is still operating rather than the people in jail where they should be. It's still a multi-billion-dollar business. Now they have addiction treatment drugs as part of their regimen. After they caused the addiction in the first place, this is Purdue Pharmaceutical. It's outrageous. And so the business part really has to be both sides. Of course, do good things for your workforce. It'll help your bottom line. But stop doing the terrible things in society that are creating a lot of unhappiness. And I think that we really need to face up to this as well.
We have... We have just 1 minute left. I need your opinion about the new ideas that we are hearing in the workforce, very briefly. We are hearing, for instance, about France banning emails after hours, the right to be disconnected. We are hearing about ideas regarding a 4-day-a-week working week constitutes of 4 instead of 5 days. So what are your thoughts on that, briefly?
Really short of time, let me respond to Jeff's challenge, which is where do you get from what's happening to what could be? And I think you're going to, by changing government policies, one of the first things that has to be done is redefine the bottom line. The bottom line is not be, for millennials who are looking for jobs, is not about making the most money for shareholders. It's about meeting all those objectives. People want to work in places that meet all those objectives. Shareholders want to invest in them. Accountants must change their self-regulation or have it change for them, so that the bottom line is triple plus. It is no longer enough for audit standards to reflect the honesty of reporting of dollar profit and loss. It should be talking about environmental results, social results, value of the product seen in social terms, and so on, because that's what auditing standards should be about measuring the overall success of the business seen from the point of view of the business, the employees, and society.
Thank you so much. One last thing, just before we leave this room, you're the happiness expert. Please, just each one of you would give us one advice for this audience, how to become happier people.
I think it's not a personal advice, it's advice for government. Jeff talked about something very important. Digital well-being should be considered seriously. And we are thinking about it here in the UAE. How do we approach the digital world with a well-being lens, whether it's the health issues, addiction, whether it's the threats, the cyberbullying, whether it's the effect on the relationship, the depression. I think digital well-being is becoming big, and we need to do something about it as
we are starting to see some laws.
And we're working on it on the UAE.
Jeffrey, where are the priorities to be
I have
happy
one piece
citizens?
of advice for everybody. Everybody should have a minister of Uhud. The UAE is doing a great job. She's going all over the world, but she can't be everybody. Unfortunately, everybody's a minister of happiness. So if your government does not have a minister of happiness, if your government is not measuring well-being, if your government's not taking this seriously, I know one that isn't, my own, which, okay.
Let's stop.
All right, I have to stop, but what I have to say is go home and make sure that you set up a ministry, a state secretary, a point of senior position in the government that will take this agenda and realize, my God, we could be doing so much more in our society for the well-being of the people.
Your Excellency Maria.
Thank you. Because this event, this big event, is not only about happiness, but also about high tech and how to use high tech for development. And we are discussing artificial intelligence in the next room. Concrete suggestions that we are developing in Portugal using eHub for good. We are developing a project to prevent gambling addiction. And this is also a very good suggestion for other countries that we can share.
Thank you so much, John.
If you don't have the ear of your government, try treating someone you don't agree with on an important question as someone you should spend more time talking with rather than simply accepting the status quo.
Thank you so much for this lovely conversation, lovely positive conversation. Thank you.
Thank you.